It is now Tuesday's edition of Over to You. I'm Fori Kanaku, and tonight I'm joined by Ashley Curry and Kirsty Inman from OCD Action. So good evening, the two of you.
Good evening.
Good evening.
How are we both?
Very well, thank you.
Good, thank you.
Good. So first of all, would you like to introduce yourselves? Ashley, would you like to go first?
Yeah, my name is Ashley Curry. I'm a 47-year-old man. I'm an OCD awareness advocate for OCD Action as an ex-sufferer. Spend a lot of work raising awareness for OCD for families and carers too, as well as the sufferers.
I'm Kirsty and I'm 23 years old and I'm also an OCD sufferer. I was diagnosed at the age of 13 and I'm trying to help raise awareness and prevent stigma.
Okay, so my first question to the two of you then is, what exactly is OCD for those who might have sort of like a sort of narrow view of it?
Yeah, hi, it's Ashley again. OCD is a serious mental health disorder where the sufferer has repeated unwanted thoughts, images and urges which causes severe anxiety and disgust, unease and pathological doubting, which then leads on to the sufferer carrying out repetitive compulsive behaviours to temporarily relieve the unpleasant feelings. According to the World Health Organization, OCD ranks as one of the top 10 most debilitating illnesses in the world due to the loss of income and decreased quality of life.
So as an OCD sufferer myself, I'd say if you can picture an on-off switch and in your brain, and it's basically where the switch is permanently on, you constantly get these obsessions, in other words thoughts that you can't get rid of, and they're disturbing, and it's just really debilitating.
So who is normally affected? Is it a case of there is like a particular group that's affected, or does it sort of grab anybody that it can?
It affects anyone ranging from children, adolescents, but it also affects the OCD sufferers' parents, carers, friends, other family as well, because it feels like they're involved with the OCD.
Also, recently studies have shown that mums who are going through pregnancy in post and perinatal stages that have had no indications of OCD whatsoever can have a sudden onset during the post and perinatal stages of OCD. Lots of this information is provided by maternal OCD, who I do a little bit of awareness work for as well. So yeah, it's vital to know that mums out there are suffering with unwanted, severe, intrusive thoughts, to seek help from that area as well.
So is it, can it sometimes be then attributed to sort of a chemical imbalance in the body then?
As it stands, most OCD Action says there is known reason what causes OCD. It's very balanced. Some people, there's indications that maybe genetic, may run in families. Some say it's a chemical imbalance in the brain. But as it stands, there's no official real reason why people have and get OCD.
Right, okay. So what are some of the signs of whether you have OCD or not?
It varies really. So if I go from my personal experience, mine started with obsessive hand washing. So if I had an argument with a family member, I felt the urge to continuously wash my hands, and it wasn't just washing my hands once. It was the thought that they were dirty and that the only way to make myself feel better was to wash my hands, but then I'd scrub them up like a surgeon and my hands would crack. That was just the start of the signs of OCD. But other people, I think if you experience extreme anxiety and thoughts, also known as obsessions, that you can't get rid of, and then you carry out a ritual, also known as a compulsion, to counteract that anxiety, then that is also a sign.
Okay, so what should someone do if they think that they or someone else has OCD?
If someone thinks or believes they have OCD, the importance is to seek early intervention as soon as possible. Either go via your GP. Some NHS areas now offer self-referral services. I know Cambridgeshire and Peterborough Foundation Trust do, which is wellbeing services, so you can access treatment that way and access a correct diagnosis. By all means, do speak to a professional and also let family members know if you believe you're suffering.
I think it's also, just to add to that, I think it's also a good idea to actually speak to somebody. So if your friend's suffering with OCD or a family member, then actually just sit down and talk to them, because I think that's the really important, is talking to people and showing that you understand and that they're not alone and they have your support.
Kirsty, so you've already said that you've been diagnosed with OCD, but Ashley, did you say you have as well?
Yes, I was diagnosed. I've been OCD free for 11 years now, so that was when I was in my mid-30s. It started at a young age in different manifestations, and then I'd go sometimes a year to 2 year free of OCD, and then a new variation would come in, like health anxiety, and then a new variation again would come in 2 years later. Then in the end it became so severe I had to go and seek help. I couldn't tolerate it anymore. It was absolutely crippling and debilitating. It reduced my working capabilities to 2 to 3 hours a day maximum. So the impact it had on myself and my family was very severe. So yeah, that was the part of my history of OCD.
And sort of, and you've both sort of mentioned it, but like, sort of, how did it affect you? Was it simply just a mental sort of affectation, or was it a combination of mental, emotional, and physical sort of effects to you?
I'd say it's a mixture of all of those, because the anxiety in itself is very crippling, like Ashley said, but you get palpitations with it and you get hot and clammy and feel sick, and I experienced panic attacks with my OCD as well. And so I was diagnosed with OCD at the age of 13, and it was, I'd say, severe when I was at school and I was an adolescent, but now it's more moderate and I can lead a normal day-to-day life with it more under control. However, when it was severe, I couldn't go out the house, which led to me getting depressed, and I also lost out on friendship because they couldn't cope or deal with me. I just have to mention that my mum's been an amazing role model and support for me, and I couldn't have done it without her, and she was the one who noticed what I was going through, and she pushed her way to get me to the top of the waiting list and helped fight my corner at school and through therapy and helped me get the help that I needed, and she still supports me, so she's amazing. Thank you, Mum.
So how did the two of you get help when you sort of first got diagnosed with OCD?
For me, slightly different to Kirsty's OCD. Mine was off and on, obviously, over the years. So, and sometimes the type of thoughts people can have quite distressing. As some people have unwanted thoughts that they might sexually have abused in the past, they might go into sexually abused in the future. So often it's very difficult for people to disclose that type of thought for fear of being judged and incorrectly diagnosed as not having OCD. So the part is that some people have these type of thoughts, really struggle to seek help, but go and get help. Once you get the help, you understand how OCD works and that you actually don't pose a risk to anybody. The types of compulsions in that would be avoiding children, avoiding holding a baby, any contact whatsoever with children would be null and void. It literally would avoid at all costs lost, because unfortunately that's how powerful OCD can be.
What is the most effective form of treatment for OCD?
The most effective form of treatment for OCD is CBT with SSRI medication. Medication is a personal choice, but the nice guidelines and clinical guidelines for treatment of OCD on the NHS in England and Wales is CBT with medication. Again, as I say, meds are personal choice, but cognitive behavioural therapy is the therapy of choice for treating OCD.
From my experience, I've had CBT with psychologists, but I'm also on medication, so I take an antidepressant daily. I've been on that for 8 years, and I found that's really helped with my OCD, from bringing it down to being severe to bringing it down to being moderate, where I can still lead a normal life.
So, are there waiting lists for getting treatment like CBT? Are they particularly long at the moment in the UK?
For some people in the UK, waiting lists are horrendous. Some people are waiting up to 2 years to access CBT, which is actually woeful. Some areas are different. Some areas access is quite quick, 3 months to accessing CBT. As I said earlier, you can self-refer if you are part of the IAPT, the Improved Access to Psychological Therapies, and they will assess you from that point based on whether you're mild, moderate or severe OCD-wise, and then you will be dealt and treated with from that point.
From my experience, when I was an adolescent and I was diagnosed with OCD, I waited over a year, and it was my mum that phoned up to try and bump me up the waiting list because I was just getting worse. But there is more therapy out there since when I was first diagnosed, so the waiting lists vary for different types of treatment.
There's a lot of stigma attached to OCD. So how do you think we can work to reducing that?
I think the main thing is creating awareness. A lot of things in the media, you'll see quizzes on Facebook, how OCD are you? I'm a little bit OCD, or I like cleaning, so I must have OCD. But it's not that you enjoy doing what the compulsions you do, because you don't. It's the constant fear that something bad is going to happen to you, so you feel the need to carry out the compulsions. So I do think that awareness is key, but also knowledge, and that's where OCD Action come in, because they're a great network for support and very knowledgeable.
With the stigma side, the importance is of reducing stigma. It then prevents people not seeking help. So once we get rid of the stigma attached to OCD, people can then come forward. The problem is the media mostly do get it right. Unfortunately, some certain programs on television, like Channel 4's Obsessive Compulsive Cleaners, is actually portrayed OCD totally wrong. And despite professionals, leading OCD charities asking for it to be taken off TV, it's now into its 4th or 5th series. It does not portray OCD whatsoever. Actually, it's very stigmatising program and can actually damage people getting help and getting the correct help that they need.
Would you say there's also like sort of from Kirsty what you were saying about those sort of tests on social media that you get, that there's like a complacency somewhat in with what OCD is? So because you'll often hear people saying, I mean, I've probably been a culprit of this myself, saying that that I'm a bit OCD when it comes to something like whatever. But
yeah, I think it definitely doesn't help with the understanding of OCD, but also it's very offensive. And okay, some things you have to try not to take to heart because just so that it doesn't affect you as much. But I think lack of understanding does contribute to this. And I mean, you see on Amazon now they're selling t-shirts about obsessive compulsive disorder, but they're using the letters in different ways, and it is actually really offensive, because if people could see how debilitating OCD is and how it ruins your life to where you become a prisoner in your own home like myself, then I think they would probably question themselves.
Ashley, you're an advocate for the charity OCD Action. So what does OCD Action do to help sufferers of OCD?
OCD Action do many things to help sufferers. They can help you access treatment. They can act as an advocacy service. They offer support. They offer support groups across the UK. They help carers and families, because obviously OCD doesn't just affect the sufferer itself, it's those who live and deal with it on a day-to-day basis. The list that OCD Action offer is available on their website, but yeah, they're one of the leading OCD charities in the country, and they have a lot to offer. they offer a youth system, OCD youth, for people who are adolescents and youngsters. They're offered support. They have days out. They have their own support groups, which is monitored very carefully. Everything that OCD Action do is fantastic in what they offer.
So you run a support group in Cambridge. Could you tell us just a little bit more about that?
The OCD support group in Cambridge, like all of OCD Action support groups, is basically a place where people can meet up, and what happens at the group is well facilitated, so everybody has an opportunity to talk about their OCD if they feel that they need to. It's non-judgmental. It's a place where people can feel less alone. They can talk about their OCD. We encourage them to try and challenge the OCD, little tests that they can have. It's a case of encouraging people and giving them hope. Once we've given the advice, any further advice, we tend to then to direct them back to OCD Action if there's any really good support, etc. that they may need.
And Kirsty, you've been a part of this support group. How long have you been a part of it?
A couple of months, and I find it really useful because I go along mainly to share my experiences of OCD to try and help others, but also my mum's very good in the sense that she comes with me to try and understand it more, but also to get support, because everybody's very understanding there, and you meet such lovely people as well. I mean, Ashley was the person that told me about the support group, and I look forward to continuing to attend.
So you said your mum goes, so it's not just for the sufferers
and carers and family alike.
And Ashley, in the first part you mentioned that you were OCD free for 11 years?
Yeah, 11 years now.
So it is possible for people to get better from OCD?
For certain people, most definitely. If that CBT is implemented early, if you have a good therapist, you can take your life back from OCD. You don't have to let OCD rule your life. You can regain and make a good recovery. Some people go on to make really good full recoveries. Some people get to 90% and they can live their life very, very well. The important thing is, though, with accessing CBT therapy, is sometimes a sufferer can be misjudged because they're working full time. So they say, well, your OCD can't be that severe. You're working 9 till 5, so obviously you don't need that much treatment, do you really? Well, in fact, this is what we call a high functioning OCD sufferer. That doesn't mean her OCD or his OCD is any less severe than someone who is inside a house and housebound. They're coping and managing to hold a job, as well as dealing with OCD, probably surviving on 2 to 3 hours sleep in the evening, and then carrying on the next day and doing the same system, what the OCD wants you to do.
So why is it the two of you think it's important to seek help sooner rather than later when it comes to OCD?
I think it helps because it's not, by no means is it an easy ride, or it's quite a lengthy process and it takes time. So the sooner you can seek help and get treatment, the better your life will be, and you're not on the right track to getting better, or at least having your life more under control.
The importance of seeking help early. At the moment, on average, it takes around about 12 years before someone accesses help and gets the correct diagnosis and treatment for OCD from first onset of symptoms, due to being unable to seek help, obviously due to the embarrassment, and also it's classed as the secret illness. But also, once they do go to access help, there's often obviously hurdles in the way. They have to fight for treatment. They look for. So you're looking at 12 years before they actually think about getting treatment. And then they're having these hurdles thrown in front of them. But when you come then to CBT for OCD, you're then looking at the lost years, say from the age of 19 to 33, 34. Sufferer has no children, never got married, probably stuck in a room on their own if they weren't working. So the CBT will treat the OCD, but you've got to look then back at the damage that the OCD has caused to the person. So yeah, you're dealing with not just the OCD, you're dealing with the big picture, and not uncommon for people who suffer with OCD to also have depression running alongside.
Ashley, could you said there was some, while we were off air, that there was some sort of extra stuff that you wanted to say about getting help sooner rather than later.
Yeah, the importance of seeking help sooner rather than later is that the delaying of not seeking help is then allowing the OCD to become more and more deeply ingrained. So the earlier the intervention, the better. So if you have any signals or signs, or within about a year you're not coping very well, don't delay, because the sooner you access the treatment, the quicker and easier, I believe, it would be easier to deal with. The light switch moment, accessing treatment earlier is vital.
And Kirsty, you wanted to talk more about sort of the signs and problems of getting OCD, sort of self-diagnosing.
Yeah, so I briefly touched on it, but some of the signs is if it takes up more than an hour of your day to carry out these compulsions, then that's one of the signs that you do have obsessive compulsive disorder. For me, the hand washing was just the start of it, and then it deteriorated because mine was about contamination. So it was the fear of being sick, because I have a phobia of sickness, and I couldn't go out the house. I'd confine myself to the room, so I'd miss out seeing friends and family and losing out on friendships. And it was that then led me to getting depressed because I was just a prisoner in my own home, really. But it's also the check-in behaviours. You're not just checking 1 to 2 times, you're actually checking 10 to 20 times, and for the fear of your flat flooding or the house burning down, and you're literally driving to work and then you go back to check because you're worried about this happening. And for me, the majority of my OCD is contamination based, and that's what took up most of my time, and it did impact me where not only relationships, but it impacted my school life, where I just couldn't attend school because through the fear of my OCD taking over and the panic attacks, but also because I was bullied by a lot of people at school to make it even worse. I mean, to be bullied because of OCD, it is not nice, but OCD itself is a bully because it's telling you what to do, and it's constantly telling you in your head, you need to do this because of this. If you don't do that, someone's going to get hurt. So it's a never-ending vicious cycle. But there is help out there, and through support, I've managed to hold down a full-time job now and get to where I am. And this is the first time I've been open about my OCD so publicly. And that's thank you to Ashley for his support to help me get to this stage.
So is learning to become your own therapist via CBT and obtaining good information about OCD from good sources something that should be recognised and implemented, do you think?
Yes, most definitely. When you access treatment for CBT, you'll be working with a therapist, and as an OCD sufferer, you are the expert of your illness. The therapist is there to work with you to bring out your intrusive thoughts. What really, sometimes, as we said earlier about the sexual type of intrusive thoughts, some people are very afraid to close it. So it's very important you build a good trust up as a therapist with the sufferer, so that you can work together. The therapist should guide you and make you become your own therapist, obviously, by doing your cognitive work and your exposure response prevention stuff. So yeah, you do learn to become your own therapist, but the key is to keep challenging the OCD through therapy, and obviously work towards a good recovery where you can regain your life from the OCD.
Kirsty, have you got any comments?
Yeah, just to touch on that. So I think once you learn to implement the CBT, and you start to recognise your thoughts and your behaviours and what's triggering this and why you're possibly thinking these thoughts, and you learn the CBT model, I think you get more of an understanding of the illness, and you're able to help yourself but also help other OCD sufferers. And it's always good to challenge your OCD, because I've found if I'm continually carrying out my compulsions, then it's actually making my anxiety worse than better, because you're in this vicious cycle.
And so you've talked about the support group in Cambridge. How can people, if they think that it could benefit them, how can people get in contact about becoming a part of the support group?
So we do have information on the OCD Action website, which is www.ocdaction.org.uk. We run it the first day of each month, and so you can just turn up to Cambridge, but we also have a dedicated support group website on the OCD Action website, or you can email cambridge@ocdsupportgroup.org.uk, or you can tweet to myself at Kirsty Inman, or to Ashley at Ashley Curry OCD, and we'll be able to point you into the right direction.
Good stuff. If you didn't get those Twitter profiles, if you look on HCR's Twitter profile, you'll see a picture of the three of us, and Ashley and Kirsty have been tagged, and OCD Action have been tagged in that picture. So have there been other things that sort of have helped in any way?
Yeah, other things that helped on my recovery was reduction of alcohol. I often found if I ever did too much alcohol, you'd have repercussions the next day, heightened anxiety, heightened OCD, so that had to be reduced. Again, that's one of the repercussions of having OCD. That means you can't go out and socialise like your friends are, but to get to that point, you want to get better, then yeah, you had to reduce it. Dietary changes, eating more healthy, that's most definitely helped me. And most definitely helped me was exercise, and running seems to be really popular at the moment with a lot of people with anxiety disorders, where they're doing these small runs and they're saying, yeah, it's really helpful, you know, I'm outside, I'm getting some sunlight, I've got targets and goals to set in life. Looking after number one is more important. So you tend to forget about yourself as a person in general anyway, so yeah, make sure you make time for you. And when you do things against the OCD's demands, always make sure you reward yourself. You're challenging a very severe, debilitating illness, so any tiny steps that you make sure you give yourself a big pat on the back. Yeah.
So just to add to what Ashley said, I found writing poetry about my OCD and depression helped me, because you're actually writing it down, and it's the way you collect your thoughts and your feelings together, and for me that helped get it out my head onto paper. I did also keep a diary, and then when I found it, decided to shred it because I didn't want the memories, and I thought I've come further, so I don't need to reflect back and feel guilty about the past, because at the end of the day we need to move on. Another thing that helped me is distraction. So do the things that you enjoy. For me, I love dancing. I do Latin American and ballroom dancing, and that gets the endorphins going and makes you feel really good about yourself. A couple of things I also feel is that if I don't eat properly, then my mind doesn't function properly, and if I also get lack of sleep, so I suffer with insomnia, which doesn't help the OCD and anxiety and depression, so it's always key to get a good night's sleep and to hopefully try and keep that routine.